Now we'll move to phase 2 reactions. In phase 2 reactions, we'll deal only a few selected, and that too very briefly, just oriented to exam purpose, and we'll finish off phase 2 reaction. In phase 2 reaction, we'll start with glucuronide conjugation. This glucuronide conjugation is most common phase 2 reaction. It is also most important phase 2 reaction. Glucuronide conjugation, it is carried out by which enzyme? UDP glucuronosyl transferase. This glucuronide conjugation and CYP3A4, which we discussed earlier, CYP3A4 together metabolize 75% of drugs. So the enzyme is UDP glucuronosyl transferase. Apart from drugs, it also metabolizes endogenous substances like bilirubin, steroid, thyroxine, which we have already seen. Now what we will see is what happened. Consider this is drug. I will label it like this. Consider this is drug. So this drug and this is glucuronide, which was in our and this is glucuronide. Consider this is glucuronide. What will happen? Where it is happening? In liver. What happened? The drug got conjugated. The drug is getting conjugated with glucuronide. So drug got conjugated with glucuronide. What happens after getting conjugated? One thing, it is polar and it's water soluble. It goes to kidney and gets excreted. Another thing is it becomes heavy. This heavy thing is secreted into bile into intestine. So this may go to, consider this is intestine, it goes to intestine. In intestine, what will happen? This drug which was glucuronide conjugated, it will be acted upon by what will be there in intestine? Bacteria. These bacteria, they will be having enzyme deconjugase. It deconjugates, it removes this glucuronide conjugate and frees the drug. So the drug will be freed from this glucuronide. What will happen if the drug is freed from this glucuronide? Again it becomes lipid soluble. If it becomes lipid soluble, what will happen? It will get absorbed. So it gets back into systemic circulation and goes to liver. So what happened? Drug is getting glucuronide conjugated in liver. It is getting secreted into intestine, and again it is getting deconjugated, and again it is returning back to liver. So what is happening? You can see a cycle. This cycle is known as enterohepatic cycling of drug. Enterohepatic cycling of drug. What happens if there is enterohepatic cycling? The drug becomes longer acting. Example of this is OCP, oral contraceptive pills. Consider if this enterohepatic cycle is lost, how can you make this enterohepatic cycle non-functional? If you inhibit this bacterial deconjugase, if you use antibiotics like tetracycline or penicillin or any antibiotic which will kill this bacteria, this glucuronide conjugation gets this glucuronide deconjugation gets lost and the drug becomes shorter acting. So antibiotic usage can also result in OCP failure. Okay. Acetylation is one more phase 2 reaction. This is carried out by enzyme N-acetyl transferase. N-acetyl transferase carries out this acetylation. What is important here is the drugs which are getting metabolized by this acetylation. Examples of these drugs are sulfonamide, dapsone pas, clonazepam, hydralazine, isoniazid and procainamide. How will you remember these drugs? You can see it as SCHIP or simply you can pronounce it as SHIP. So if you remember this ship, you will remember the drugs getting metabolized by acetylation. So why it is important? Because so why this acetylation is important? Because what I said, this is a non-microsomal enzyme. There are fast acetylators and slow acetylators. If there are fast acetylators, the activity of these drugs in fast acetylators will be less. The drug is less efficacious. In slow acetylators, there will be toxicity precipitated. So slow and fast acetylators are important for this. So remaining phase 2 reactions, methylation is carried out by methyl transferase, sulfation is carried out by sulfotransferase, glycine conjugation, ribonucleoside or nucleotide synthesis. This is important in antimetabolite like purine, pyrimidine, antimetabolite drugs, antimetabolites. These are used in anti-cancer therapy. This phase 2 reaction is used for activation of these drugs. Ribonucleoside nucleotide synthesis is used for activation of purine, pyrimidine, antimetabolites which are used in cancer therapy. One last phase 2 reaction which is remaining is glutathione conjugation. You already know about glutathione conjugation. If you might have come across this in physiology, pathology as well as in biochemistry. Glutathione GSH, its role is in reactive oxygen species, neutralization of this ROS, reactive oxygen species. It inactivates, similarly in drug metabolism, it inactivates highly reactive intermediates. Example, paracetamol metabolism. See, paracetamol metabolism, I have said at many places, in alcohol, in CYP2E. Let's summarize it. Consider this is paracetamol. It is metabolized by CYP2E1, what I was said, CYP2E1 to a toxic intermediate. That toxic intermediate is N-acetyl parabenzoquinine. This toxic intermediate causes hepatotoxicity. But this is only 5%. This is only 5% is getting metabolized through CYP2E1. The remaining 95% of the paracetamol is metabolized by conjugation reactions. Conjugation. Which conjugation? Glucuronide conjugation or sulfation. So this is 95% of the drugs are metabolized by this conjugation. 95% of paracetamol is metabolized by this conjugation, that is sulfation and glucuronidation. Now what will happen to this NAPQI is it gets detoxified by glutathione. So what happens in case of paracetamol toxicity is, if there is more dose of paracetamol taken, this glucuronide and sulfation gets saturated. Both of these get saturated. Glucuronide and sulfation get saturated, and more of drug will be metabolized by this CYP2E1, and pathway will be diverted to more NAPQI production. But still GSH is there to metabolize this NAPQI. But what happens with the time, this GSH is also depleted, hence NAPQI will accumulate. This NAPQI is reactive oxygen species which will cause hepatocyte damage or hepatic injury. So in paracetamol toxicity, one more thing is what I said, CYP2E1, this is induced by alcoholism. Why I was repeatedly saying alcoholism? Because in alcoholism CYP2E1 activity is increased, so that more NAPQI is formed. Apart from that, this GSH is also depleted in alcoholism. In alcoholism, this is also depleted. GSH, alcoholism depletes this GSH. So how will you treat this paracetamol toxicity? Simply you can give this GSH. But the problem with glutathione is it is not lipid soluble. It will not cross liver. It will not reach till the site of action, that is liver hepatocytes. So you need to give something which will generate this GSH, and that something which generates GSH is that is, you might be knowing, it is N-acetylcysteine. N-acetylcysteine is used as a specific antidote in paracetamol toxicities.